Good morning and welcome to our health and wellness segment with me, Shiko Kaitani. Karibu sana as well through our social media platforms to continue engaging us. It's always a pleasure coming to you, giving you great content, and we also appreciate the feedback that we continue to receive at K24 TV across the board is how you can reach us. Instagram, Facebook, X. We've got our WhatsApp number at the bottom of your screen should you wish to contribute to our ongoing discussions on K24. I'm surprised today my director is not the one and only Bonadan. We've got Kasavuli on the decks. She's the one who's going to be controlling today's show. Nimesikia akisema nimefika masaa yangu Kasavuli ushaanza kunibuli, but we love you, honey. Karibu sana on the controls, and of course let me know if we can start off with our Vox Pops, because we did collect a few in regards to today's show. So cue me on that as well as on our feedback. And speaking about our topic, we've got a good one for you. We're tackling chronic diseases this morning. Africa is confronting a daunting new healthcare challenge when it continues to struggle against many of its long-time nemesis. The healthcare system on the continent has always been strained, if you think about it, under pressure from deadly infectious diseases. And now, unfortunately, there is a sharp rise in non-communicable diseases. So today, we will be understanding what those diseases are and those catastrophic effects and just why we need to pay attention. We've got the pleasure of having the chairperson of the Chronic Disease Society of Africa. I'm talking about Faith Okwisa Okwayo. Faith, welcome to the show.
Hi.
Looking lovely.
Thank you so much.
All right, so even as we hope our viewers will start texting in, I think just, to give this conversation some context by understanding what your missions, your goals, your mandate, if you will, as the Chronic Disease Society of Africa is all about.
Yeah, thank you so much for the segment. At Chronic Disease Society of Africa, we are very keen to alleviate the burden of the chronic illnesses in Africa, and starting from Kenya, because this is where our nascent chapter is.
Okay.
So chronic diseases are a double whammy, because in Kenya right now, we are having an intersection between chronic illnesses and communicable diseases. Right. So we have not totally eliminated the infectious diseases, and yet we have a spike of chronic illnesses. So we have responded to the WHO call for action on just being here to make sure that the primary healthcare coverage of chronic illnesses is being underscored by the governments. And the government is already overwhelmed as it is, so we're here as a third party to fully and just make sure that we are here to take care of the patients who are living with chronic illnesses.
And so when we talk about what these chronic diseases are, I know there's a whole range of them, but maybe you can give us the top killers that honestly are really causing this burden, and you're seeing more and more of it on ground. So what would you classify?
So in Africa, about 41 million cases of mortality are coming from the top 4 categories, which are cardiovascular diseases, diabetes, cancer, and lung illnesses.
Oh, wow.
So these ones are very prevalent, and we have a spectrum of over 26 chronic illnesses. But the top 4 are cardiovascular diseases, which encompass the heart diseases, diabetes, which is highly proliferated across Africa, and obesity even.
Wow, can you imagine Africa getting to the point where we're dealing with issues of obesity?
Yes,
goodness,
because of behavioral changes in our food production. We are obesity is here with us, and obesity is not the orthodox definition that people think someone has to look big for them to be obese. You just have to have a BMI of above 30. So you could really be normal looking, but you are carrying extra weight. And overweight is a metabolic syndrome that now leads to so many of these chronic illnesses.
Okay.
Yes.
Well, we took to the streets as our breakfast crew, and of course went to speak to Kenyans about their view and their take on chronic diseases. Take a listen.
What chronic diseases do you believe are common amongst Kenyans?
One of the most chronic diseases is such as cancer in Kenya, among others, but I think cancer is the one that's mostly affecting Kenyans.
Mostly cancer, arthritis, are the most commonly known chronic diseases.
I think there's cancer, diabetes, I think high blood pressure.
Hizo makansa.
Throat cancer, pancreatic cancer, yes, and also tuberculosis can also be counted one of the chronic diseases.
Some of the chronic diseases I know, it's like cancer.
We have cancer, we have the arthritis, we have the tuberculosis, we have the HIV and AIDS. Yeah, and even malaria nowadays is also chronic. If you don't go to the hospital, we have the I don't know, it's called acute malaria, where you have that severe headache that may, if you don't visit the hospital very quickly, you can even die.
In your opinion, are all chronic diseases attributed to lifestyle?
I don't think so. Yet it's still a factor, but it's not the most, you're seeing the cause of it. No, it also depends with how someone takes care of himself health-wise. So it all starts with you and how you do your stuff, what you eat, just hygiene.
Poor lifestyles, yes, because poor lifestyle, because of what we eat, we don't exercise. And we also don't go to the hospital. You're supposed to go for checkup, at least annually or even daily. We don't go.
Napata kwa liku ingine kwenye unakaa ma area zingine ni kuchafu hivi, saa vitu kaa hizo.
Some of these diseases are actually brought by the kind of foods that we eat. Like nowadays, so many people take a lot of sugar, these plastic things. And even the environment where we live, they don't live in the kind of the environment that we live also lead to these diseases.
Most of them are brought about by lifestyle. For example, some of the cancers, for example, throat cancer, lung cancer. As you know that most of the people, they engage in drug abuse, especially cigarettes, smoking cigarettes, and they cause cancer. So they are brought about by lifestyle. Kuna also high blood pressure, or it's also known as hypertension. It's brought by.
Okay, so you can hear a few of the comments, or at least people's thoughts on chronic diseases. And Faith, what's the general feeling that you picked up on from what Kenyans were saying on the streets? Does it mean that, okay, are we still at the point where there's a lot of lack of awareness?
Yes.
Or at least people have an idea.
People have an idea, and they are very right.
Yeah.
However, there's still a lot of work to be done in terms of creating awareness, education to reduce the level of stigma in the society, where now the patients are being stigmatized for having chronic diseases because they are attributed to lifestyle. They're not necessarily just lifestyle, because you'll find even in the low and middle income communities where people are just eating the most basic of foods and maybe even just using the vegetable oils alone, they can still trigger chronic illnesses.
Right.
So it's not lifestyle in the sense that we think we know.
Okay.
Yeah.
And it's interesting because when I was actually reading up on this, they talk about how modernization rather is a huge factor or key factor that has increased the risk of developing these diseases. But how so? People moving to urban areas, think about, what life is like in the city. So talk to us a little bit about that.
So yeah, urbanization is a big risk factor towards exacerbation of chronic illnesses, mostly diabetes. I will talk about the metabolic syndrome.
Yeah.
Because now change of lifestyle, because initially we were meant to be hunter-gatherers. We had the Paleolithic diet where we were eating boiled foods, eating one meal a day. Then once you are urbanized, you have to now adjust and have more of processed foods, which sometimes then the crystallization cause a lot of glycation in the body, leading to chronic illnesses. So by the time now you're going for your checkup, and mostly everybody has a risk of being pre-diabetic, because just by virtue of aging, you are predisposed to diabetes. So if you're not going for your regular checkups, and then you find that by the time you're hitting your late ages, like you're becoming geriatric, you are realizing you have diabetes and you've been having it for 10 years.
All right.
So the late diagnosis is what now leads to now high cost of disease management.
And it's very sad because when you think about how these diseases creep up on you, it's unfortunate because, like the way you're saying, some of these are conditions that people are living with and have no clue that they are on the onset of it.
Yes, yes.
And then you get up into your mid-ages, into your senior years, and then now it's full-blown.
Yes.
So this is why we need to pay attention to this, because you never know. These are what they call the silent killers, right?
Yeah.
But I want to put this up for our viewers, Faith, and listen to what the World Health Organization actually described chronic diseases are. Now, NCDs, and Faith obviously will expound more on that, non-communicable diseases, that's what it stands for, are the result of a combination of genetic, psychological, or physiological rather, environmental and behavioral factors. Tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets are all increase, or rather all increase the risk of dying from a non-communicable disease. So let's just stop there, Faith, for a second. Because look at that, genetics, physiological, environmental, behavioral factors. So it's almost like there's no winning with chronic disease.
There's no winning, and they say 85% of mortality comes from a chronic illness. And the virtue of the fact that it's chronic, it means you have to be maintained on medication till mortality.
Right.
So once you're diagnosed with it, it's not a death sentence per se, because you can then now have this best practices that will reduce the symptoms. But now you have to live with it for the rest of your life, maintain the medication. So the reason why we formed the Chronic Disease Society of Africa was triggered by this, by the fact that prevention can be better than cure in this sense. Delay of the onset of the symptoms is better. And then now just educating the patients and engaging the communities to understand how to sometimes navigate when they're already diagnosed or prevent. So we have a lot of early detection camps and patient screenings that now lead to patient education.
Yeah, and let's just pick up on that and just talk about the importance, you know, when we are talking about screening, when we're talking about how important prevention is. Why does this matter, and why should we be pumping in more money, more resources into that, prevention and screening?
Simply to reduce the cost of treatment. Because already in Africa, we are facing, like we said, a double burden. And in Africa, we are also underinsured. Insurance is not prevalent, and we are still working on getting the primary healthcare coverage. So as we are dealing with all these problems, including poverty, we do not want also to add the cost of living and the disturbance of economic factors, which, you know, once you're diagnosed with a disease, you're not able to be very productive economically. So early detection helps prevent this, and it helps educate people early on, because most of these diseases are multimorbid. What do I mean by that? Once you are diagnosed with diabetes, you are highly likely to die from cancer. Yes, it's not diabetes that kills, because diabetes now just makes your immunity very, very weak. And then now, because of all that medication, you can lead to other predisposition of metabolic syndrome, that's heart disease, cancer, even chronic kidney disease. So early detection can now help reduce the comorbidities of these diseases.
Well, remember, you can actually weigh in and also text us through our WhatsApp number at the bottom of your screen. If you prefer, obviously, using other social media platforms, well, karibu sana. Kasavoli, please do let me know when we can actually start looking at text messages as we move along. But for now, let's talk about the challenges that individuals are facing in managing and treating those chronic diseases. What are these challenges?
The first challenge is lack of awareness, because most of the people, after they've been diagnosed with chronic illness, they are discharged and then they become very stranded. Because the doctors are already swamped, they have a lot of queues, and they do not have sometimes time to take the patients through the patient journey. So now patient journey education is lacking, patient engagement is lacking, and community building is lacking. Then there's now the pharmaceutical end. Africa, we are not enjoying a lot of equity when it comes to pharmaceutical drugs, because most of the chronic illness drugs, chronic semi drugs are imported. So by the time they have landed, the margins are spiked, and then the cost of the drug is high. And sometimes we are mostly 40% out of stock for these drugs.
Right.
So a patient is still trying to access the medication that they need. They're still trying to afford. Affordability is an issue. And then they don't even know how to handle themselves at home. Some of them, their caregivers are maybe in Nairobi and their parents are maintain on drugs in the rural areas. So lack of engagement of these patients and communicating on how to navigate the patient journey is an issue. And we step in that gap as Chronic Disease Society. Once the patients subscribe to become our members, we put them in small cohorts. Very small ones where they are having access to the community-based healthcare workers who are now navigating with them, and advising them daily on how to treat the symptoms, when to see a doctor. We link them to care. We make sure that they can access the specialists and navigate.
That's amazing. And of course, you'll tell us how that structure actually works, because at the end of the day, you know, we want our viewers to understand, okay, if I have a loved one or me myself have been diagnosed with disease X, what next? How do I actually join these little pods that obviously will help me get the kind of health care that I need? So that's a very important thing to just put a pin on. As we're getting towards the tail end, we'll be asking Faith to tell us a little bit more about how the structure works, obviously with the organization, which is the Chronic Disease Society of Africa, and those pods that are available for you to actually join. Now, the impact of this perhaps isn't really felt on a large scale, but I like to break things down to the family unit, because they say the family unit is the SI unit of society. And when you think about what happens when a family member is sick with a chronic disease, how does this negatively impact the family?
First, it causes a lot of confusion, and then there's that shock value, especially let me speak about cancer. And I have a very personal story where I lost my dad to cancer during Corona. So, you know, when Corona hit, there was a disruption in the Medicare and healthcare ecosystem, right? It's fine. So chronic diseases are not visible. So it's so hard for the society to even try and treat them urgently, as urgent as they need. So unless maybe when you have a disability, it's visible, someone can say, hey, this needs action. But for chronic illnesses, because it's a slow burn, it's hard to see. So my father, back to the story of my father, he was diagnosed with diabetes. And he was being treated for diabetes, well treated for diabetes. Because of lack of that patient education of knowing how to navigate diabetes, the diet aspect of it, what to do, what not to do, what to avoid. He lived his lifestyle but taking medication for diabetes. Little did he know it will accelerate to kidney disease, to cancer, to heart failure, you know. So once you have diabetes, you should not go back and relax and even say, hey, I don't even need medication anymore because I'm feeling okay. No. Once you have that disease, you have to take it very seriously, so that it doesn't generate into a more adverse effect. Yes.
It's interesting, now that you brought up COVID-19, and like you're saying, the pandemic changed everything. It's sad because even if it caused this disruption, there was also it accelerating these diseases. And so talk to us about how COVID actually affected the management, the treatment of these chronic diseases.
Yes, so we had a privilege of doing a study in 5 African countries, sponsored by the Global Fund, on post-COVID disruption of access to medication for people who are in diabetic clinics, tuberculosis clinics, HIV, and even cancer. So once COVID set in, of course, there was that nervousness in the ecosystem, and most patients were asked to stay at home, because once you have COVID and you already have a low immunity, your chances of survival were slim. So that gloom made patients stay back and not go to access their medication. So most patients succumb to their chronic illnesses because they could not access their primary essential drugs.
Right, and then remember how challenging it was even to get to a health facility. You're being told wait.
And then the doctors were receiving the patients with a lot of prejudice, of course, rightfully so. And then there was that holding period of 24 hours to observe. So that really affected patients because of just the stress level of it. And remember, depression is a chronic illness. Mental disorders are very chronic.
And please say that again. Yes, it is now a chronic.
It's a chronic illness. Alcoholism is a a chronic illness. And all these are interrelated. There's a lot of intersection and overlapping of these conditions. So having personalized patient education, where there is a community that spends very good time with these patients to educate them on what to avoid and what to do is very essential, and we stepped in that gap. There are so many unmet needs, but information is the first step towards disease management. Disease surveillance and planning is needed. So the chronic illnesses are taken for granted, largely by the governments, because they are busy just trying to ease the burden of the other infectious diseases or other diseases that are visible. But the 50% killer right now in Africa actually is chronic illnesses.
That is very worrying news when you think about it. Faith, allow us to take a short commercial break. When we actually get back, there's definitely more to come as we discuss what the solutions are. What's the comprehensive approach, FYI, that we're going to be using towards chronic diseases going forward? And I think, you know, just listening to what this particular organization is doing, it's great. Let's also listen to some of the partnerships, collaborations that are out there helping individuals who are living with this particular chronic diseases, okay? But yet again, as we take that commercial break, you still have that opportunity to engage with us. Give us your thoughts. Our WhatsApp number 075-7725-083. We will see you in just a few.
Blackie, K24 TV Mix Master. Like a boss.
Yo, when it comes to playing the best music videos, we've got you covered. Check this out. Caribbean,